process things. It just takes me a little longer. I'm a bit slower than the average student. And this gets back to the fact that they may be dealing with multiple problems, maybe not all severe, but cumulative in their functioning impact. Family physicians told us over and over, cancer patients, particularly childhood cancer survivors, are rare in my practice. Just tell us what to do in one page for each patient. They don't have these are not a big group of patients in their practices. They can't afford, and it's not worth their time to learn all the information they need to know about this heterogeneous group in training, but they need to know when they need to know it, which is when that patient is in front of them. Then from health system decision makers. With cancer survivorship for children, you run into the same challenge, but it's even more complicated because they're not only moving from being a child to an adult, which is a whole different kettle of fish in terms of how you treat them in the system, but they also have some very specific chronic conditions related to the treatment. And not every GP or even specialist knows how to deal with that. So whether it's a kid who's had cancer and is now cured but has some ongoing lingering chronic issues, or whether it's a severely disabled child that can be seen at children's till 18 or 19 and all of a sudden they're adrift, we've got a challenge. So there's a recognition that there's a gap there. So what has happened in the last 6 months is a coalition of survivors, family practice physicians, oncologists, and institutions such as our BC Cancer Agency and Children's Hospitals. We have been meeting to provide recommendations